Hi everyone, this is Dr. Sonahita Agarwal from Arya Dental and Orthodontic Clinic, Lucknow, and today I am going to share a case with you which I felt was phenomenal, and I feel that it will motivate you also to get your teeth treated and to go for a better smile. So this case is important because what we expected, uh, I didn't expect. Like the results that I got, I didn't expect that at all. So usually in my clinic, most of the patients, the adult patients, those who come, usually come for दांत आगे हैं, दांत थोड़े टेढ़े मेढ़े हैं, गैप है, ओपन बाइट है. These are the common cases. तो जब भी दांत बाहर होते हैं या फॉरवर्डली प्लेस्ड होते हैं तो my set dialogue is that I need space. अगर आपके दांतों के बीच में स्पेस नहीं है and your teeth are forwardly placed या टेढ़े मेढ़े हैं तो I cannot work without space. In aligners, when we do a scan, the major ways of moving teeth or creating space is by extraction. या तो हम दांत निकालते हैं. If the proclination or severity is too much, then there is no way other than going for extraction. या फिर if it is mild to moderate, then we go for IPR. IPR means Interproximal Reduction. ये क्या करते हैं, इसमें दांतों के बीच में हम स्पेस बनाते थे. जैसे ही मैं बोलती हूँ दांतों के बीच में स्पेस बनाते हैं, फटाक से क्वेश्चन आ जाता है पेशेंट का कि आप दांतों के बीच में आप घिसेंगे, आप दांतों के बीच में दांतों को काटेंगे, व्हाट अबाउट सेंसिटिविटी, व्हाट अबाउट अदर इश्यूज. सो IPR, I feel if done properly can help you a lot. That is what it all depends on experience. हम लोग दांतों के बीच में we use very thin strips. We use exact how much ever is prescribed, na zyada na kam, and we try to maintain the anatomy of the tooth. That is very important and actually difficult also. So when you're not maintaining the anatomy or if your strip is going little wayward, तो contact आपका अच्छे से नहीं बनता है, तब जाके प्रॉब्लम आती है. प्रॉब्लम तभी आती है जब आप स्पेस ज्यादा बना रहे हैं जरूरत से, विच इज नॉट प्रिस्क्राइब, या फिर आप ढंग से नहीं बना रहे. तो आई फील IPR इज गुड if in the hands of an experienced person. So these are the two ways. Third way is digitalization, where we move teeth back. The पीछे के दांतों को पीछे ले जाते हैं और पीछे ले जाते हैं ताकि आगे स्पेस बन जाए. But again, it depends on the case. So this was a female. She had come around in her 20s, and she had come with a chief complaint of forwardly placed teeth. She felt कि मेरे दांत बहुत ज़्यादा आगे हैं. She had come with her brothers, and कि दांत बहुत ज़्यादा आगे हैं, and she had her marriage in around 8 months, and her wedding was there, and she didn't. She wanted results. So first of all, results cannot be achieved so quickly. Even with braces or aligners, nothing, it cannot be done so quickly, because aligners also you need around aligners also, because aligners also per aligner 0.25 mm of movement is there. More than that we cannot do, around 0.525 to 0.3 mm. More than that it's not possible. So every aligner, 4 aligners, it's 1 mm of movement. That's how slow it is, but it is faster than braces. That's what I feel. So we told the patient, you have to inform the patient that the results can go over 10 to 12 months also, and in extraction cases तो ज़्यादा ही जाता है. So we did a scan. That is the first step consultation का, जिसमें हम स्कैन करते हैं और पेशेंट को प्री और पोस्ट दिखाते हैं. तो प्री और पोस्ट में उनका चेहरा और उनके दांतों को प्लस एक्सरे को देख के इट वाज अ क्लियर कट केस ऑफ एक्सट्रैक्शन. एक्सट्रैक्शन मतलब दो दांत ऊपर के प्रीमोलर्स. प्रीमोलर्स आर नॉट यूज्ड. वी हैव 2 sets of premolars on each side. So first premolars is usually extracted. सदियों से first premolar निकाला जा रहा है braces में भी, ताकि दांतों को पीछे set किया जा सके. So we advised her for 2 extractions in the upper and 2 extractions in the lower. These premolars are very safe. एक्सट्रैक्शन से मैंने पहले भी वीडियो बनाया है, उससे आंखों पे, दांत पे, दिमाग पे, कहीं पे भी कोई असर नहीं होता है. इनफैक्ट रिजल्ट्स बहुत अच्छे आते हैं, बिकॉज यू गेट एन इंस्टेंट ड्रामेटिक इफेक्ट. So that is the plan I made, and then they were saying, her brother was like, the family will not agree for extractions. Family will not agree. So what can I do? I mean, treatment cannot change according to family. But still, we did because we have done a scan just to show her कि एक्सट्रैक्शन के अलावा IPR से पॉसिबल नहीं है, I did the planning on IPR. I incorporated IPR and showed her the pre and post. So they were happy with that. They were like कि इतना भी अगर अंदर हो जाए तो बहुत है, हमें पूरा अंदर नहीं चाहिए. This is what we want. So you have to take the patient with you in your treatment plan, their expectations, their motivation, what they want from the treatment. So and a written consent also, that this is what they want. So we tried to convince the patient for extraction, but they didn't agree. And finally, after everything, explaining to the patients, still the patient was adamant कि extraction नहीं करना है. So we went with IPR. Now IPR में भी दांतों के बीच में जब हम जगह बनाते हैं तो एक लिमिट तक ही बना सकते हैं, that is 0.5 mm. कुछ अलाइनर का 0.6 0.7 भी करते हैं, but we I do Invisalign a lot, so we keep it at 0.5 mm. 0.5 mm per contact area, मतलब एक दांत से 0.25 mm ही जा रहा है. So that is very very minimal. But the computer picks it up and cumulative effect इसका अच्छा आ जाता है when you do it on several teeth. And then the patient went off because she lived far away. Out of station patient थी, she cannot come for regular appointments. So she took her aligners and she went away. And I asked her that after your marriage also, please come once, because you need proper follow-ups. So follow-ups in Invisalign we used to do with your app. In app you have a feature जहाँ पे आप अपना selfie ले सकते हैं, the teeth area, and just because follow-up में I just do the checkups of your teeth fitting. So I did her checkups, everything was fine. IPR was done before only, all the IPR. And once she got married, after around 6 to 7 months, I think on the 7th month, she came. She was halfway through on the aligners, and she came for a consult. And I'm telling you, this is real. She was sitting in the waiting room. I had just got late. I entered, I saw her, and I did not recognize her. I went straight away inside. And then I said, okay, what happened? The patient hasn't come yet. And then my assistant told that this is the same patient. That is the effect this treatment had on her face. And that is why I have made this video, to show you that with proper planning, you can get dramatic results also without extraction. So this was the pre of the patient. This is the post, not post, it's progress. We are halfway through, and still I can see how aesthetic her smile has become, how dramatically her teeth have gone inside. She is feeling more confident. In fact, I feel her face has changed. Actually, her face shape has not changed. What was prominent was her teeth. That's what we could see. But abhi aisa lagta hai face has become more rounder. So I feel I can see the smile reaching her eyes. She is looking genuinely happy. And this is what gives me satisfaction. When I do a case and I see that I've changed a little bit in somebody's life, then that is the satisfaction what I'm working for, nothing else. So I hope that this video also motivates you also to take charge of your life. And if you feel that you need some change in your smile, you can go for aligners or braces and do it, because the later you postpone it, the more difficulties you encounter. In kids, it's very fast treatment. It's more easily done than in adults. So this is today's video coming to an end. If you feel you have some problems like this, now this video should not come across, this is a disclaimer, should not come across that all cases can be treated with IPR or extractions are not required. No, extractions are required. Some cases, rarely, exceptions are there, where you get good results, dramatic results with IPR also. But that doesn't mean I'm going to do every case with IPR. If it is extraction indicated, I will give it as the first option. So please listen to your doctor. Don't let this video convince you otherwise. This video is just to show you the dramatic change, and also to tell you how aligners can change how proper planning can change your smile. Call on the number if you feel you have a similar problem, and we'll try to solve it. Thank you so much.